My name is Dr. Andrew Bradford. I'm a specialist in Rehabilitation Medicine, and today I'm going to talk to you about fibromyalgia. I'll explain a little bit about what fibromyalgia is, a bit about the symptoms, about the diagnosis and the treatment. So fibromyalgia is characterised by generalised pain lasting at least 3 months. It may be associated with abdominal pain and gastrointestinal changes or upset. It can also be associated with headache and migraine. There may also be some sensory symptoms or sensitivity to sound and to light or sensitivity to touch. It's often associated with fatigue, sleep problems, mood problems, and cognitive difficulties which can affect memory, concentration and decision making. Most patients would normally visit a GP and some may be referred to a rheumatologist. You should expect a sympathetic consultation based on principles of biopsychosocial medicine. It's normal to give a full history and have an examination, and you may have some blood tests to look for markers of inflammation. You may be examined to look for signs of arthritis. Other conditions that can mimic fibromyalgia include rheumatoid arthritis, autoimmune conditions, thyroid issues, chronic fatigue syndrome, and some neurological problems such as multiple sclerosis. There's no real test for fibromyalgia. There are some scales such as the Widespread Pain Index and the Symptom Scale, which are sometimes used to confirm the constellation of symptoms and make a diagnosis of fibromyalgia. The mainstay of treatment is early tailored education with a focus on self-management and self-care. The initial intervention would be lifestyle changes, looking at diet and encouraging exercise, and also looking at problems related to sleep. Cognitive behavioural therapies is useful for managing mood problems, anxiety and depression, and also helping coping with chronic long-term pain. Physiotherapy can be useful for strengthening exercises, for flexibility, for core strength, and improving activity. An occupational therapist can provide useful help, advice, support and equipment for managing at home independently or at work. You may also find that there are some support groups that are available that can also provide support. The pharmacological treatment is primarily symptomatic, so these would include pain medications, opiates, medications such as duloxetine or amitriptyline, gabapentin, other mood stabilizing drugs, medications for sleep and antidepressant medications. And some patients find prescribed cannabis medicines useful for some of these symptoms. I hope you found this information useful, and if you suffer from fibromyalgia, I wish you every success in finding appropriate support and help, and please feel free to get in touch. Thank you.